Thank you so much, and thank you all so much for inviting me to talk about chronic fatigue syndrome and ME. As Lina very kindly said, I'm a conventionally trained doctor. I did 20 years of conventional medicine, and now I've done another 20 years plus of naturopathic medicine. And what us naturopathic doctors are doing is we are asking the question why. We're trying to look for root causes of diseases. And when I went into general practice, people coming to me and saying, why do I have blood pressure? Why do I have migraine? Why do I have arthritis? And of course, we're not taught that at medical school. We are taught it's that symptom and this drug, that symptom and this drug, which doesn't get to the root cause of problems. And nowhere was this problem greater than in the field of chronic fatigue syndrome, ME, and fibromyalgia, because doctors simply weren't asking the right questions. The patients are asking the right questions. People want to know why they have these conditions, and that I have made my special area of interest. So that's what we're going to talk about today. Okay, so as I mentioned, people with chronic fatigue syndrome and fibromyalgia say they are. There's a bit of a joke here that I won't tell, but basically they're not wealthy. People who have fatigue syndrome, they're unable to work. And if you can't work, you can't earn some money, and therefore it makes it very difficult to access good treatments because doctors like myself are often expensive. So as I say, my job is to give everybody, and all my information is freely available on my website, and I've written several books about it, the rules of the game and the tools of trade so that you can do it yourself. And the best advice I can give you today is take control of your own health. You can do it yourself. Lots of my patients do, all my patients do, and some people cure themselves entirely without consulting anybody, just with the information that we've got. So these are all very doable interventions. And the key point is to distinguish between the diagnosis and the clinical picture. So chronic fatigue syndrome is a clinical picture. It's the clinical picture that we see that's characterized by poor energy delivery mechanisms. Things like poor energy levels, no stamina, all activities have to be carefully paced. If you overdo things, you pay for it the next day. These are all poor immunity, organs go slow. These are all characterized by poor energy delivery mechanisms. And then the clinical picture of ME is the same as chronic fatigue syndrome, but in addition to that, we've got inflammation. And inflammation occurs when the immune system is busy. And the immune system can be busy for reasons of allergy, autoimmunity, or chronic infection. So when we understand the difference between clinical pictures and true diagnoses, that gives us a very clear roadmap as to where we've got to go. And today we're going to start off talking the first half about poor energy delivery mechanisms and how we address those. And then the second half, we're going to talk about ME, which is how we tackle the inflammatory aspects, the inflammatory holes in the energy bucket, as I put it. So that's the overall picture. Now, when it comes to energy delivery mechanisms, an analogy that I love to use, because I get it and my patients get it, is the car analogy. Because if you think of our body as a car, we are, use that analogy. For your car of a body to go, you've got to have the right fuel in the tank. So, I have an old car parked outside, which I normally put diesel fuel into it. But if I put petrol into it, it wouldn't go. And so the first thing we have to do is get the fuel in the tank right. And that is all about diet and gut function. And this is the starting place. It's also the most difficult thing I ask people to do. Changing your diet, and we'll talk about how we're going to do that, is difficult because it means changing the habits of a lifetime. People all think they're eating a healthy diet, but that's not necessarily the case. So diet and gut function we will talk about. And then, of course, for your engine to go, you've got to have oxygen going in there. If I switched off the oxygen supply to any of you, you would very quickly die. So oxygen is obviously essential, and that's all about the right breathing techniques. And then we have, as I call it, the mitochondrial engine. And as Lina very kindly said, that's been my special area of interest. That's why I've done original research and published papers. And every single living cell in the world, almost without exception, is alive because of mitochondria. So my little dog sitting on my shoulder there, you know, she is powered by mitochondria. So are the sheep in that field. So is the grass that I'm looking at. So are the trees. You know, mitochondria are a fundamental part of all life. And if your mitochondria are functioning, then you have energy and you can be alive. If mitochondria fail and you don't have energy, then you are dead. They really are the difference between life and death. And then we have to have the control mechanisms, those mitochondria. And to use the car analogy, the thyroid gland is the accelerator pedal. That works on how well mitochondria function, how fast they go. And then we have the adrenal gearbox. And the adrenal gearbox allows us to gear up in response to stress. So, you know, obviously I need more energy to talk to you guys than if I'm sitting in a chair having a rest. And my adrenal gland allows me to do that. It allows me to gear up with adrenaline, cortisol, DHEA, to increase energy delivery mechanisms so that I can present coherently today. So that, as I say, is the roadmap. That is the outline. But it all starts off with the fuel in the tank. If we don't have the right fuel in the tank, then mitochondria simply can't function. Now, whenever I have a difficult question to ask, you know, what should we be doing? I always go back to first principles. And humans have evolved over hundreds of thousands, you know, millions of years eating a paleo ketogenic diet. And our bodies are geared for that. And paleo ketogenic means, first of all, low in carbohydrates. So we energize our body, we fuel our body with fiber and with fat, because the perfect fuel for mitochondria are ketones. That's what they function best on. And I know many people run their bodies on sugars and carbohydrates, which is rocket fuel in the short term, but very damaging to mitochondria in the long term. So the ideal fuel, say, is ketones. And then it's paleo because it has no gluten grains and no dairy products. The reason we have no dairy products is all those there, but a very important one is it's a major allergen. And I got interested in this whole field through my interest in allergy. You know, I'm allergic myself, and I can't have any dairy products. And that is a very common issue for many people with fatigues, because dairy products will drive inflammation for reasons of allergy and possibly autoimmunity as well. So we know, for example, that dairy products are growth promoting. They're a risk factor for cancer. We know they're a risk factor for heart disease because they give us sticky blood and magnesium deficiency. They're a risk factor for autoimmunity, and we're seeing epidemics of autoimmunity in children at the moment. And the three big risk factors are dairy products, vaccinations, and vitamin D deficiency. They're also a risk factor for osteoporosis. So, so that's why we shouldn't be eating dairy. But the key is, I say it's a high-fat, high fiber diet. I've written a book about it called the Paleo Ketogenic, the why and the how. And what I love people to do is to test, to make sure that they are in ketosis. And that tells us that they've done the diet well enough, because so many people kind of delude themselves. They cheat, if you like, over the diet. They think they're doing it and they're not quite. So testing is very helpful. So this is the book that I wrote about it. And this details, you know, what you can eat, what you can't eat. Tells about how much fiber you need, how much protein you need, how much sugar you need, how much carbohydrate you need, So that gives you a good idea about the diet that you have to. And much of this is on my website. So if you don't want to buy the book, there are also details on my website. And as I say, the ideal fuel for mitochondria are ketones. And these are three ketone bodies that we produce when we are fueling our body with fat and with fiber. The most important one is beta-hydroxybutyric acid. And that is the main fuel for our mitochondria. And yes, you can measure that in the bloodstream, but that entails doing blood tests. And I'm a bit of a wimp. I don't like doing blood tests. So I prefer to test either the urine, where acetoacetate is excreted, or by breath testing. And the best machine I use is this. It's called an ACE track. And it's very accurate, and it tells you exactly when you are and when you're not in ketosis. So that's a very helpful tool. So the second thing we have to do to ensure the correct energy delivery mechanisms is sort out the upper fermenting gut. Now, we could talk all day about this, and I'm mindful I've got a very short time to present a lot of information. But the problem with the upper fermenting gut is if you have a diet that's high in sugars and carbohydrates, then the upper gut, which should be a sterile gut, so the stomach, duodenum, jejunum, small intestine, should be near sterile. For the business of digesting and absorbing foods. But if you overwhelm the upper gut with sugars and carbohydrates, then it starts to ferment. And the fermenting upper gut causes a whole host of problems. You're fermenting to produce toxins like alcohol, D-lactate, hydrogen sulfide, ammoniacal compounds of which poisonous. The microbes themselves have toxins, so fungi have mycotoxins, bacteria have bacterial endotoxins, and they poisonous. The microbes themselves can get into the bloodstream, get stuck at distal sites where they drive other pathologies. Other pathologies like fibromyalgia, arthritis, urticaria, acne. In the gut, they drive inflammatory bowel disease. So just by sorting out the upper fermenting gut, you can treat and prevent a whole host of other pathologies. So this is part of the regime, and we must do this before we do anything else. So we do the way we treat the upper fermenting gut is, first of all, we stop feeding them. Stop feeding them carbohydrates and sugars, i.e. we starve them out with a paleo-ketogenic diet. And then we kill them with vitamin C. So yes, we starve them out with by not feeding them, and then we kill them with vitamin C and we kill them with iodine. And the joy of using vitamin C and iodine is they do lots of other useful jobs as well. They help us to detox. They help us to deal with systemic infection. They're important for our antioxidant status. They're essential for thyroid gland, and so on and so forth. But the important thing with vitamin C and iodine is don't take them at the same time, because they knock each other out. So I usually start with vitamin C in the daytime, and then Lugol's iodine lasting at night, and the doses are there. Now, remember, whenever you put in a new intervention, whether that's diet, whether it's vitamin C, whether it's iodine, you can get detox reactions, you can get die-off reactions, and the more ill you are, the slower you have to go. So start with low dose of vitamin C and build up gradually to bowel tolerance. Same with iodine. Start with low doses and build up the dose gradually. And those simple interventions go a long way to treating the upper fermenting gut. And once you've sorted that out, then you can absorb things. Okay. And sorry, I'm hopeless at jumping ahead of myself. Apologies. But this is how illustrates how much pathology can be driven by allergy to microbes in the upper fermenting gut. So if you've got all these microbes busying away in your stomach, they spill over into the bloodstream and they get to distal sites where they drive autoimmunity, inflammatory bowel disease, arthritis, muscle and connective tissue inflammations, rosacea, acne, etc., etc., etc. So sorting out the upper fermenting gut really is the starting point to treat so many conditions. Okay, and once we've got rid of the upper fermenting gut, then you can absorb micronutrients. And I see so many people who come to me and they spent a fortune on micronutrients, but they're malabsorbing them because they are still fermenting. So at this point, we can start to take a basic package of supplements. And we all need to take that basic package because of intensive farming. Essentially, there's a one-way cycle of minerals from the soil into plants, into animals, into us, and we discard them. We don't compost human manure. We don't return it to the fields. It's thrown away. And that means our soils are deficient, our plants are deficient, and we are deficient as a result. And over and above that, we're poisoned by chemicals that are added to food, to water, and the air. Again, they're used in the farming industry, and these effectively are anti-nutrients. We need more micronutrients in order to help us to deal with those toxins. So the basic package of something I like people to take is a good multivitamin, a good multimineral, vitamin D, vitamin C, iodine, essential fatty acids. The actual details are on my website. So if you want details of how much and what, then you can find all that there. Okay, and then we need oxygen. Obviously, we all know that we need oxygen in order for our metabolism. That's why we breathe air. But we need the right amount of oxygen and we need the right amount of carbon dioxide. Now, just to explain this, the first question we have to ask is how does oxygen get around the body? And the answer is, in the lungs, when we inhale, oxygen hops from the lungs onto hemoglobin within red cells, and that makes them go bright red, and they circulate around the body. They circulate around the body until they get to a busy cell where a mitochondria needs that oxygen, and the oxygen then jumps off the hemoglobin and to the mitochondria where it's needed. But the real question we have to ask is, how does oxygen know how to hop onto hemoglobin in the lungs, but jump off hemoglobin when it gets to mitochondria? And the answer to this is acidity of the blood. And the acidity of the blood is determined by carbon dioxide, which is the exhaust fuel that comes from mitochondria. So when our mitochondria are busy, it's burning oxygen and generating carbon dioxide. And that carbon dioxide dissolves in the bloodstream to render the bloodstream slightly acidic. And the slightly acidic nature of the blood allows oxygen to jump off hemoglobin to the mitochondria where it's needed. But of course, the opposite is true in the lungs. In the lungs, when we're breathing, we're washing carbon dioxide out from the lungs, and therefore the blood is slightly alkali. And where the blood is slightly alkali, then oxygen will hop onto hemoglobin. Just to reiterate that, it makes perfect physiological sense, but that is the overview. So lungs, low carbon dioxide, alkali, so oxygen sticks to hemoglobin, and the reverse is true in mitochondria. Now, the problem is many people don't breathe correctly. They overbreathe, they hyperventilate. And this is very common in people on carbohydrate-based diets, because when you're on a carbohydrate-based diet, you're producing adrenaline, and adrenaline makes you hyperventilate. And that has the effect of washing carbon dioxide out of the blood, and therefore the blood becomes too alkali. And if the blood is too alkali, then oxygen cannot get to mitochondria where it's needed. They're starved of oxygen and symptoms result. So I don't think, okay, so I haven't included the breathing exercises because there just simply wasn't time to talk about all that. But again, get in touch with me and or we could do a separate lecture on overbreathing. But hyperventilation, details on my website. So now we've got that in place. Just to reiterate, we've got the fuel in the tank, we've got the breathing right, and then we have to look at what I call the mitochondrial engine. Now, and it's only now we can fix the mitochondria, and they can be going slow for a number of reasons. They can be going slow because they're fed the wrong fuel. And as I say, the preferred fuel of mitochondria in the long term are ketones. They're starved of oxygen. Well, we've done that, haven't we? Because we have learned new breathing techniques. And then they could be going wrong because they're deficient in something. They could be going wrong because they are blocked by something. And they could be going wrong because the control mechanisms are wrong, the thyroid accelerator pedal and the adrenal gearbox. And then, of course, all our mitochondrial engines, just like any car engine, has to be regularly serviced. And we do that during sleep. And so we need good quality sleep and then a few micronutrients in order to allow healing and repair to take place. But first of all, we need a package of supplements for the mitochondria. And this is the bare minimum that we require. Again, we've worked this out through original research, which we haven't got time to go into today, although I could do more details in my books, of course. But that's the bare minimum of supplements that we need. I'm not going to read them out because that will waste time, but you can read that. And you're welcome to have this PowerPoint presentation when I've finished if you want to go back and check. But all these details are on my website, freely available. And then we have to get rid of the things that block mitochondria. And I say mitochondria are like little engines. And if I threw a handful of sand into a car engine, it would choke up, wouldn't it? It just wouldn't work. There'd be friction in there. It would go slow. And there are many toxins and chemicals which can block mitochondria. And we know this from translocated protein studies done by the brilliant John McLaren Howard at Acumen Laboratories. And the main mitochondrial inhibitors are products of the upper fermenting gut. Well, we've solved that, haven't we? Because we're doing a paleo-ketogenic diet and we're taking vitamin C and iodine. So we've got rid of that one. Prescription drugs are major blockers of mitochondria. Statins are one of my most hated drugs. They block mitochondria. So do beta blockers. So do many prescription drugs, including some antibiotics. So so look at the drugs that you're taking and work that out. And if you are taking drugs, always ask the question, why are you taking them? Because many drugs for high blood pressure or cholesterol or diabetes, we can reverse all those pathologies. We can reverse diabetes with a paleo-ketogenic diet. So always ask the question, why? Why am I taking drugs? Do I really need them? Is there an alternative? And then, of course, the addictions, many of the addictions block mitochondrial function. Sugars and carbohydrates do for reasons of fermentation. Caffeine stimulates in the short term, blocks in the long term. Chocolate, nicotine. For some, now interestingly, for a very, very few people, nicotine is helpful as a nicotine patch, not as smoking, but as a pack. But that's another story. But addictions, generally speaking, alcohol, of course, switch mitochondria off. And then there's a whole package of toxins in the environment, like pesticides, volatile organic compounds, perfumes. If you can smell something, it's in the brain, it's in the body with the potential to inhibit. And those can be got rid of, first of all, by avoiding them, but also by Epsom salt baths. Toxic metals, we can get rid of those with detoxamine. And then, of course, chronic infection can inhibit mitochondria. So these are the things that most commonly inhibit mitochondria, and we know this from studies at Acumen, and those are the common things that the problems. Lactic acid, for example, if we're not pacing our activity well, we produce lactic acid, and that inhibits mitochondria. Products of fermenting gut, I mentioned some of these already, but these can all block our mitochondria, and we have to think about them if we're not making progress with the basic regimes. Okay, and at this point, we then have to balance up the control mechanisms of the thyroid accelerator pedal and the adrenal gearbox to allow us to very closely match energy delivery with energy demand. Because if we miss out on that, then that is potential disaster. Now, these regimes that I'm using, and I constantly refer to them, I call groundhog regimes. There's a film called Groundhog Day. It's a comedy. It's a time loop where our hero comes back to the beginning of the day and tries to relive the day again in a different way. And it's called Groundhog Day. And I pinched that name and I call them groundhog regimes because I keep coming back to them over and over and over again. And there are the links to my website where are the details of them. But basically, we should all be doing groundhog basic all the time in order to live life to our full potential. And then if we get an acute infection, we put in place groundhog acute. And really important amongst that is vitamin C to bowel tolerance, big dose of vitamin C, and using iodine. But if we get chronic illness, and that might be dementia, it might be heart disease, it might be cancer, it might be ME, we should aim to do groundhog chronic, which is obviously the other two things and more. So those are my overall regimes. And details of all this is in my book, Ecological Medicine, if you want to read more about it.